I'm going to teach you guys a little bit about post-traumatic stress disorder, or PTSD. So basically what is it? It's a mental health condition that's triggered by a terrifying event. And that can be either experiencing the event or witnessing it. And it's actually not as common as you might think it is, because people often go through traumatic events, but they can usually get better over time. But with PTSD, that's when your symptoms last for maybe months or years, and it's more of a chronic kind of thing, and it interferes with your daily life functioning. So symptoms of PTSD, they may start within 3 months of experiencing the trauma, or they can occur years after the event happens. So these can lead to problems in your relationships and situations at work or with friends and family. 4 types of PTSD symptoms do occur, which these are intrusive memories, avoidance, negative changes in thinking and mood, and changes in emotional reactions. And I'll go into those in a little bit here, but the intensity of these symptoms can vary over time, and you may have more symptoms when you're stressed in general, or when you run into things that remind you of the experience that you went through. You may even end up having thoughts of suicide, so if that happens, please get help right away. So in this slide, it looks a little small, so we'll just kind of like zoom in here so you can just see what each one is about. There's basically intrusive memories, negative changes in your thinking and mood, changes in emotional reactions, also called arousal symptoms, or avoidance, which the basics behind each one of these is listed here. So here you have intrusive memories, which basically are recurrent. It's basically considered a flashback. These could include upsetting dreams, or you might experience emotional distress. Negative changes in thinking and mood, that would consist of maybe negative feelings about yourself or other people. The ability to experience positive emotions is gone, so you can't even, you're not really even happy, you're emotionally numb, you're hopeless about the future, you may have a hard time maintaining close relationships, things like that. As far as changes in emotional reactions go, you might be irritable, or you might even become aggressive. You are probably going to usually be on guard, and you may feel guilty. There are also sleeping problems that occur with this, concentration problems. You might be easily startled or frightened, and you could even begin to harm yourself. As far as avoidance goes, you try to avoid even thinking or talking about the event, and you avoid places or things that remind you of the event. So anything to get away from it, basically. Causes of PTSD occur when you either go through, you see, or you learn about an event that occurred that was traumatic. And traumatic meaning it could have involved actual threatened death, serious injury, or sexual violation, or of course other causes. These are just some listed. It's speculated that it's probably a complex mix of causes due to such as these, which would be inherited mental health risks, life experiences, including the amount and severity of the trauma that you've gone through since early childhood, inherited aspects of your personality, which is often called your temperament, and even the way the brain regulates chemicals and hormones that your body releases in response to all the stress that's occurring. So risk factors of PTSD, as you can see, they're all listed here. Most commonly, the most common kinds of traumatic events that would lead to this, over here we can see there's combat exposure, which most people think of when they think of PTSD. You think of different military and war scenarios, as you can see here and up there. Childhood neglect and physical abuse, sexual assault, physical attack, and being threatened with a weapon. Basically, a risk factor would be anything that causes you to experience an intense or long-lasting trauma. It could have been experienced earlier in life as well. It could also be a job that causes you to experience those traumatic events because you're exposed to them more often. You could have other mental health problems such as anxiety or depression, a lack of a good support system, or even family members that have had mental health problems. To test and diagnose for this, we're basically going to be looking at the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, and basically you're diagnosed based on your signs and symptoms and thorough physiological evaluation, and referring back to this manual here. So the manual describes diagnosis as you can be diagnosed if you were exposed to an event that involved involved death, violence, or serious injury, and you're experiencing any of the following symptoms. So we've kind of already talked about these symptoms, so I'm not going to cover them again. Also, in addition to this, more than a month after the traumatic event, you may also experience other symptoms of PTSD. So again, some of the other symptoms that we listed, the symptoms may cause significant distress, and they will probably interfere with your ability to go about living your everyday life as well. To treat this, the primary treatment is psychotherapy. But we do often supplement this with medication. So the different types of psychotherapy include cognitive therapy, exposure therapy, and eye movement desensitization and reprocessing, or EDMR. Basically, cognitive therapy is when you talk about it to recognize cognitive patterns that keep you stuck. Exposure therapy is when you're basically exposing the things that frighten you to yourself and therefore trying to overcome them in a safe environment. And EDMR is when you include exposure therapy and guided eye movements to process those traumatic memories and change how you react to them. Medications include antidepressants, anti-anxiety meds, and prazosin, which you may take if your symptoms include insomnia or recurrent nightmares. So for coping and support, some ideas would be to follow the treatment plan, to learn more about PTSD itself, to take care of your own body, to not self-medicate, to make sure you break the cycle and talk to someone, even considering a support group. And you can prevent PTSD from developing if you have timely help and support is received. These are my references, and I hope you learned a little bit more about PTSD. Thank you.